Hello and welcome. Today we're diving into a rare and fascinating congenital condition, bladder duplication. This occurs when a person is born with two bladders instead of one. We'll explore what causes this, how it impacts the body, and what can be done about it. The exact cause of bladder duplication remains largely unknown. It's considered a developmental anomaly, meaning it occurs during the early stages of fetal development. Genetic factors are suspected, but no specific genes have been definitively linked. It is believed to be caused by the incomplete or abnormal splitting of the cloaca, the embryonic structure that eventually forms the bladder, rectum, and reproductive organs. Essentially, something goes wrong during this process, leading to the formation of two separate bladders. Normally, urine flows from the kidneys, through the ureters, and into a single bladder where it's stored until urination. In bladder duplication, this process becomes more complex. Each bladder may have its own ureter, or one ureter might drain into both bladders. This can lead to several issues. The bladders might not empty completely, increasing the risk of urinary tract infections. Urine reflux, where urine flows back up the ureters towards the kidneys, is also a common complication, potentially damaging the kidneys over time. The duplicated bladders may also not be of equal size or function. Bladder duplication is extremely rare. Accurate estimates of its prevalence are difficult to obtain due to its uncommon nature and the possibility of misdiagnosis or asymptomatic cases. It's reported to occur in less than 1 in 150,000 births. It doesn't appear to have a strong gender predisposition or ethnic association, affecting individuals seemingly at random. The signs and symptoms of bladder duplication vary depending on the severity of the condition and the presence of other associated anomalies. Some individuals might be asymptomatic and only discover the duplication incidentally during imaging for other reasons. However, common symptoms include frequent urinary tract infections, urinary incontinence, particularly during the day, difficulty urinating, feeling of incomplete bladder emptying, abdominal pain or discomfort, and in severe cases, kidney problems such as hydronephrosis, a swelling of the kidney due to a build-up of urine. Diagnosing bladder duplication typically involves a combination of imaging techniques. Ultrasound is often the initial diagnostic tool, particularly in prenatal settings or for young children. Voiding cystoarthrogram, or VCUG, is a special X-ray that visualizes the bladder and urethra while urinating and can demonstrate the presence of two bladders and any urine reflux. MRI and CT scans can provide more detailed anatomical information, particularly helpful in surgical planning. Cystoscopy, a procedure where a small camera is inserted into the bladder, allows direct visualization of the bladder anatomy. Bladder duplication can be categorized based on the degree of duplication and the presence of other anomalies. One common classification divides it into complete duplication, where two fully formed and separate bladders exist, each with its own ureter, and incomplete duplication, where the bladders are partially separated, sometimes sharing a single ureter or urethral outlet. A special condition is a bladder diverticulum, which is a pouch or sac that is not a separated bladder, but an outpouching of the bladder wall. Treatment for bladder duplication depends on the specific anatomy, symptoms, and associated complications. Asymptomatic individuals may only require observation and regular monitoring. However, surgical intervention is often necessary to correct anatomical abnormalities, prevent recurrent infections, and preserve kidney function. Surgical options include bladder reconstruction, removal of one bladder, ureteral reimplantation to correct reflux, and bladder neck reconstruction to improve continence. The specific surgical approach is tailored to the individual's unique situation. Since bladder duplication is a congenital condition, there are currently no known preventative measures. Prenatal care and genetic counseling may be helpful in identifying risk factors and understanding the potential for recurrence in families with a history of congenital anomalies. Early detection and intervention are key to managing the condition and minimizing long-term complications. The prognosis for individuals with bladder duplication varies. With proper diagnosis and treatment, most individuals can lead relatively normal lives. However, long-term follow-up is essential to monitor kidney function and address any recurrent urinary problems. Research into the genetic basis of bladder duplication is ongoing, with the hope of identifying specific genes involved and developing strategies for prevention in the future. Recent advances in surgical techniques, including minimally invasive approaches, have improved outcomes and reduced recovery times for patients undergoing bladder reconstruction.